Narcissistic personality disorder. An example of a personality disorder is narcissistic personality disorder, NPD, which is characterized by a grandiose behavior pattern, a desire for adulation, and a lack of empathy. People who suffer from NPD frequently have an exaggerated sense of self-importance, feel entitled to preferential treatment, and crave constant praise from others. The relationships, career, and general quality of life of a person may all be significantly impacted by this illness. We shall look at the signs, causes, diagnosis, and therapies of narcissistic personality disorder in this video. Narcissistic personality disorder symptoms. The following symptoms of NPD are listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Grandiosity. Those who have NPD tend to overstate their perception of their own accomplishments. Even in the absence of proof, people could think they are better than others. 2. Need for adoration. Individuals with NPD yearn for the admiration and attention of others. They could actively seek out compliments and praise, and they might take it personally if they don't get it. 3. Lack of empathy. Those who have NPD struggle to comprehend or care about the emotions of others. When dealing with other people's emotions, they might come off as icy, uncaring, or even cruel. 4. Arrogance. Individuals with NPD may come out as egotistical or arrogant. They could have an inflated view of their own skills while underestimating those of others. Envy. People with NPD may harbor feelings of envy towards others, especially those they believe to be more attractive or successful than themselves. When they don't get the same amount of support or adoration, they could try to discredit these people or become irate. 6. Exploitation. Those who have NPD may use other people for their own gain. They could exploit others for their own benefit or use them to further their own objectives. 7. Self-righteousness. Those who have NPD think they are entitled to preferential treatment and advantages. They can take it for granted that others would satisfy their wants and aspirations. Narcissistic personality disorder causes. The exact causes of NPD are unclear. Some scientists think that a confluence of genetic, biological, and environmental elements may be at play. Studies have revealed, for instance, that individuals with NPD frequently have a history of childhood trauma, such as emotional maltreatment or neglect. Other elements that could influence the emergence of NPD include 1. Childhood overvaluation. Children who get excessive praise and overvaluation from their parents may grow up with an inflated feeling of their own worth, which can later cause NPD. 2. Lack of empathy. Due to a lack of emotional sensitivity throughout childhood, people with NPD may find it difficult to empathize with others. 3. Overindulgence. Children who get excessive indulgence may grow up to feel entitled and demanding, which can result in NPD. 4. Genetics. Although additional study is required to establish this, several studies have suggested that NPD may be inherited. Narcissistic personality disorder diagnosis. Due to the fact that those who have NPD may not consider their behavior to be wrong, diagnosing this condition can be difficult. They could believe that their haughtiness, craving for praise, and lack of compassion are acceptable or even desirable. People with NPD may occasionally put off seeking treatment until they have serious issues at work or in their personal relationships. A mental health expert will normally carry out a thorough assessment, which includes a clinical interview and psychological testing, to diagnose NPD. The doctor will check for NPD symptoms as well as those of any co-occurring mental health conditions, such as depression, anxiety, or drug misuse. Narcissistic personality disorder treatment, NPD treatment, might be difficult because NPD sufferers frequently lack insight.